All right, well, hello everyone, and thank you so much for joining us. The Southeast Mental Health Technology Transfer Center would like to welcome everyone to today's webinar event, Why People Stay, Workforce Retention in Community Behavioral Health. My name is Emily Moore, and I will be moderating today's event. Please note that the work of our center is supported by a grant from the Substance Abuse and Mental Health Services Administration, or SAMHSA. And please also note that our center and the larger MHTTC network use affirming, respectful, and recovery-oriented language in all activities. The Southeast Mental Health Technology Transfer Center is proud to serve the 8 states in HHS Region 4. Our expertise in public health programs, systems, research, and evaluation provide a unique lens through which we can address mental health priorities. We encourage you to visit the Southeast MHTTC website, mhttcnetwork.org/southeast, to learn more about our center and upcoming events. A few important notes to review before today's event. This webinar is being recorded and will be made available on our website for on-demand viewing soon. We encourage you to share your thoughts throughout the presentation using the chat feature. Please remember to select chat with all attendees if you would like to share your thoughts with everyone. We have allotted time at the end of the presentation to answer questions. Please submit your question using the Q&A feature at the bottom of your screen. Finally, for participants who are interested, a certificate of attendance is available for download after completion of our evaluation survey. Let me take a moment to introduce today's speaker. We are very excited to have her back. Michelle P. Salyers, PhD, is Professor of Psychology at Indiana University, Purdue University, Indianapolis. She directs the ACT Center of Indiana, a collaboration of academic and community partners, including researchers, administrators, clinicians, consumers, and family members who share an interest in recovery-oriented, evidence-based practices. The overarching goal of her work is to help adults with severe mental illness live meaningful lives in the community. Her research addresses both consumers of mental health services and providers of those services. She is increasingly targeting the interaction of consumers and providers, looking for the best ways to support relationships that promote recovery and well-being. Her current work involves developing effective ways to reduce staff burnout and to increase shared decision-making in mental health care. Thank you so much for being here, Michelle, again, and I will turn it over to you.
Great, thank you, Emily. Let me do share screen. Okay, great. Hopefully everyone can see my slides. And it's great to be back. This is one of my favorite topics, are talking about things related to staff well-being. And today we're going to focus on why people stay in our jobs. And I need to open the chat function. I love to see where people are coming from. So, oops, if you can share in chat where you are. I am in Sarasota today, and it is very hot today, but I love to see where people are coming in from. Oh, New York to Florida, Michigan, Arizona, Washington, Oregon. Wow, all over the place. This is great. Well, welcome. And for those of you who've been to some of my presentations in the past, welcome back. I enjoy partnering with the Southeast Mental Health Transfer Center, Technology Transfer Center. Wow, Washington too. Great. Well, welcome everyone. So our roadmap today, where we're going to go, I thought I'd start a little bit with some of my background of what brings me to this work and how I think about turnover and retention issues. And then we'll define staff turnover and the scope of the problem for our field in particular, and what impact it has on our services and the people that we work with, and talk a little bit about what the research shows about why people might leave. And then we'll talk more about how retention is different. So our focus is on why people stay And sometimes it's not the same as the opposite of why people leave. And then I'm going to spend a little bit more time on a current study that we're doing in a community behavioral health setting. And this is hot off the presses that we have analyzed the data, and we are in the process of writing up a paper from those findings and want to share that with you. And then I do always like to focus on the practical side of things. So what can we take away from this? And what can you do back in your own organizations to make a difference? So first, I'm wondering, now I know where you are in the world here, what is your role and how long have you been there? And just kind of wondering, are you, am I talking mostly to administrators or team leaders or frontline staff? And what is your own job retention look like in your particular role? 20 years. Congratulations, Nikki. That's a long time in a position. 24 years. 31 years. Great. Oh, 6 months. Welcome to the world here in behavioral health care. Social workers. So a nice range of people, administration, direct service, lots of different roles. Great, 10 years, fun. New supervisor, but 15 years in the field, great. Well, welcome everyone. So my own background is that I'm a professor and a researcher, and my roles have changed. But I have been at my university as faculty for 23 years. And before that, I was a graduate student at the same university. So I had 2 years at Dartmouth, but about 28 years total at my organization. So I come from kind of a longevity in one place kind of thinking. Let's see. I am a clinical psychologist, but I'm also, I like to say, a closet organizational psychologist, that I think a lot about organizational psychology issues as well. And I actually teach graduate students in my role, and I often work with both clinical students and organizational psychology students. And my focus as a clinical psychologist and through my training was to focus on people with severe mental illness and focusing on psychiatric rehabilitation and how we help people recover from the effects of mental illness and be able to work and live and love and all of those things out in the community. And through that work, I've worked a lot with service providers over the years. So we have had a technical assistance center in the past where we did a lot of training around evidence-based practices and really getting to know what it's like, the stressors of the day-to-day work in this field. And my goal is ultimately to improve outcomes both for providers of services and participants in those services. And so a lot of my work has been on staff burnout, both from understanding what the factors are and then how to intervene and hopefully reduce burnout. And I've done actually a series here, and you can look for it on the website if you're interested in more of the kind of self-care aspects and things like that that can help reduce burnout. So today's focus will be a little bit different, focusing more on how do we keep the staff we want to keep in our organization healthy and those kind of things. But for more stress management, I would say you could look to some of those breathe workshops. So what is staff turnover? And we can look at a dictionary definition that talks about the number of people hired during a certain period to replace those who are leaving. And we usually think about a time frame usually within a year. What is your average turnover within a year? And the same dictionary also uses ideas like upset or shakeup. So we usually think of turnover as something that causes some chaos or disturbance in the system. But if you look farther down in the definitions, turnover can also be the continuous process of losing and replacing parts of a living system. And organizations are, in a way, a living system. They're made up of the people who are part of that organization. And so turnover is a natural process, and it can be good until it's not, when we have too much turnover. Okay. So how much turnover do we have in the behavioral health field? Some studies are in particular places, and they might have really high rates in a particular place, but on average, we think about 30 to 35% annually. So that means for every 3 people you have in your organization today, one of them is going to be gone in a year from now, at least. And for some people, that seems relatively high, to lose a third of your staff at least in a year. But we can do some kind of downward social comparison and look at other industries. In the retail industry and hospitality industry have much higher rates of turnover. And some of those are 70 to over 100% of people leaving within a year. So while behavioral health care has turnover, it could be worse. But it is a growing problem. And I'm not sure how many of you have heard this term, but it's been used quite a bit recently to talk about the Great Resignation during this pandemic time, that we have seen unheard of kind of rates of turnover. And last year alone in the United States, 47.4 million people quit their jobs. And the US Bureau of Labor Statistics tracks this. And I think every quarter they put out a report for the monthly quit rates. And we still have high rates per month. So in April was the last one that I could see. And so during this time of the pandemic, our turnover issues have been much worse than before. How much turnover should we have? In chat, do you have any guesses about what would be a good rate of turnover to see? Or what, if you're an administrator or HR person, what you hope to see? 20, 10, none. Yeah. Okay. Well, some of you guessed exactly right. The general recommendation is about 10%. And ideally, those are your low performers that are leaving. It's really hard when your best people are leaving, but generally 10% is good. So some of the effects of turnover and why we don't want 0%, even though on the surface that seems like it'd be great if no one left. Turnover does bring in new people who have new ideas and new energy. And there's some research that shows that teams who have been the same teams for a very long time tend to get into groupthink. They agree with each other. They're not going to necessarily rock the boat so much because those relationships are so strong and important. So having new people come in a little bit can bring in those new ideas and new energy. So some turnover is good. But a lot of turnover can be bad because recruiting and hiring costs. So just the idea of trying to find a new replacement person who's going to fit, hiring them, training them. If you're doing certain types of practices that require fidelity, say you're doing a certain type of therapy that is manual based, and you want people to get to a certain level, that takes a lot of time. And there's really a lot of burden on the remaining staff. So who's going to cover for those absences when people leave? And there's often a time when people leave, you don't replace them right away with someone who is functioning at that same level. So there's a time when other staff have to pick up the slack. And then there's less continuity of care. And there's some mixed reports on whether turnover is actually bad for clients. We often think it will be, but some of our own research showed that it might not be that bad for clients, depending on the type of issues that they're working with. But certainly there's less continuity of care. It takes time for your clients to get to know the new people. So having a lot of turnover has some negative effects for sure. So why do people leave? What is it about the behavioral health field that makes people want to leave? And most studies measure intent to leave, or how we're thinking about leaving rather than actually leaving. And so I have a quick poll to bring up here with just 2 questions. It'll be anonymous this way, so not in chat. If you could take a moment and answer both of these questions. So thinking about in the last 6 months, how often have you considered leaving your job? And then how likely are you to leave your job in the next 6 months? And then you press submit. And then I think Stephanie will show the results, or do I have to click on something? Oh, there we go. Okay, so most of you are not thinking about leaving that often. And then how likely are you to leave in the next 6 months? So just a few people, maybe very likely, somewhat likely for some of you, but most of you are not very likely to leave. These are the types of questions that we ask when we do turnover intention research. And in this study, I highlighted one particular study that a colleague of mine did because he measured both intent to leave and actual leaving the job. And what he found was that turnover intention, so thinking about leaving, those 2 questions we just answered, are closely related to job stressors. So people who are really emotionally exhausted in their work, have a lot of work-life conflict, and have less job satisfaction are more likely to think about leaving and say that they're likely to leave. But actual turnover is more personal. And what we found is that the predictors of actual turnover were different from the predictors of turnover intention. And the people who actually left a year later in this study tended to be women, and they were younger and had children under 5 at home. So we can imagine the role conflict and having a lot of personal conflict, I guess, or stress between work and childcare. They were also earlier in their career and less educated or had less experience. And we'll talk about this again later. In part, that may be the people just coming out of school and trying different jobs until they figure out where they want to be. And part of that may be a normal kind of learning experience, but it may also be kind of a generational or cultural difference for younger people in their careers. And then actual turnover was related to being less likely to report having worked overtime. And we were a little bit surprised by this because we thought the stress of having to work overtime or feeling like you were working after work might be related to being more likely to actually leave. But it may be more that people who are working overtime are feeling more commitment to the organization and feeling like that they're putting more effort in. And so maybe they are less likely to leave because of that commitment or extra effort. But that was kind of interesting to us. So after about 100 years of research on why people leave, finally, the field is really starting to focus now more on retention and why people stay. And job retention is not the same as the opposite of why people leave. And Mitchell and Lee are a couple of the researchers in this area who've spent a lot of time looking at job embeddedness theory and why people stay. And they talk about these on-the-job forces and off-the-job forces that factor into how embedded we are into our current jobs. So how embedded are we? In this theory, they talk about 3 different aspects of embeddedness. First are the links we form in our organization, and these are the formal and informal ties we have. How much social support is there? Do we have friends at work? Do we have social capital? So do we know who to go to get things done? Do people trust us? That's part of that social capital. And the second one is fit. People who have a very strong fit or compatibility with the organization and their mission and values are much more likely to be embedded in the organization and will stay. And then the third one is, what sacrifices would we have to give up to leave? Would we give up our health insurance, for example? And for some people, that may be really difficult to give up. It may be related to our self-image. We've always thought of ourselves as a caregiver or caretaker. But if we leave this field or this job, how does that affect who I am and how I see myself? And so when we think about job embeddedness, these are the 3 key areas that we would think about. But importantly, in this theory, they also talk about our families and our communities have embeddedness of their own, and that can affect our job embeddedness, right? So you may be in a community that has very few options for behavioral health, but you're embedded in that community. Your partner has another position somewhere in the community. You may have children who are in the school systems and you don't want to leave. And so you're embedded in that community. And if you see very few options elsewhere, you might have a sense of more commitment to your organization, or sometimes maybe more stuckness too. And they can interact with aspects of the job. You can also think about family embeddedness. Maybe you have very strong family ties and family needs, and that may be pulling you away from your embeddedness in your job. So we think about links, fit, and sacrifices when we talk about job embeddedness. So why do people stay? There's less research on stayers. So the theory says we stay because of these links and because of our fit, and that we don't want to give up important things. But it's only really been in the last 10 years, 15 years maybe, that a lot of research has been started in this area, and not very much has been done on behavioral health. So we've got quite a few studies on turnover and turnover intentions in particular. But we only found one study related to behavioral health on why people might stay. And that was a social work study of social workers in child protection and welfare services in Ireland. And what they did was they identified people who had stayed 10 years or more, and they did interviews and surveys with this group. And they found that factors related to job embeddedness were present in these interviews. Plus, the people they interviewed talked about really having a commitment to social work, that they viewed themselves as social workers. It was part of that self-image. They also tended to have a positive and challenge-oriented perspective. So that strengths approach that is so important in our recovery work. And they had a lot of social support and autonomy on the job. So they were trusted and had flexibility to make decisions and to do things on their job. And while this was an important study, it was in Ireland. It focused only on people who were social workers, and all of them were working for one single state run agency with 5,000 employees providing services. And so that might not translate as well to our service system. And so we wanted to do another study on stayers and why people stay. And so I'm going to go into that particular study that I've been working on with my colleague Sadaki Fukui and Emily Bass, and she's a graduate student who works with me. And we are focusing on the qualitative analysis of long-term employees. And this is part of Sadaki's larger study that he's doing. He's working on a data-driven management system where he's using machine learning to actually predict job turnover. So we've worked with a couple of community mental health centers, and he's gotten together HR data and service data and training data, and uses all of that to feed into the computer to create algorithms to predict who is likely to leave. So that is a study that is ongoing and a really fun, cool study that I've been fortunate to be a part of. So as part of a sub part of this study, we identified what we called the extreme stayers. So people who had been there more than one standard deviation above the mean for the average tenure at this organization. And that was around 14 years. And so we invited all employees who had been there at least 14 years to be part of these interviews, with the exception of a few of the people were our actual research partners, where we wrote the grant with them and they are helping us run the study. And so we didn't interview those folks. But we did this via Zoom, and unfortunately, as the pandemic started, so did this study. So it was around, it might be on our next slide, I think. Nope. Okay, anyway, it was maybe June, I think, of 2020 when we first started the interview. So it was right after that immediate kind of lockdown period. And so that was interesting to do those interviews during that time. So our sample, we had 23 people who were eligible. So that was that 23 people had been there at least 14 years and were not part of our research team. And of those, a little over half agreed to participate. And the stayers, the people who were eligible, were more likely to be white, they were more likely to be male, and they were more likely to be in exempt jobs. So these are more like salary positions and kind of executive, more professionalized roles. And we're going to come back to this because this is an important finding in and of itself, is who is staying a long time at these organizations. So what did we do for our interviews? the interviews were done either by myself as a clinical psychologist or Emily, the doctoral student. And we scheduled 45 minutes for these Zoom calls, but I think they went from maybe 25 minutes to an hour and a half. So one person was really excited to talk about why they stayed. And we did some semi-structured questions. And so we started with this grand tour question about, tell me about your role and what you do. What does your day look like? And that was to kind of get them talking and to help us understand what it was that they did in their work. And then we asked them directly, why do they think they've stayed so long? And we had some little probes to follow up. And then we asked if they had ever considered leaving. And if so, what happened during that time and why did they stay? And we recorded all these interviews, and then afterwards we made some summary notes, and then they were all transcribed and coded so that we could pull out specific quotes. And then we analyzed them as a team where we read the quotes and tried to make sense of them and put them in different categories. And then we also had this process of member checking where later we came back to the organization and showed them what some of the things were we found, and a couple of focus groups, people would tell us what they thought about those things. So we tried to follow a pretty rigorous process with qualitative interviewing this way. So why did they stay? 4 main reasons: passion, support, opportunities, and then some personal attributes. And so we'll go through each of these a little bit. So passion for the job, the mission of the organization, or the people served. And everyone talked to some extent about passion, that they really love the population, they really love the work they do. And some people talked about all 3 of those things. And this is a nice quote that shows that: I stayed primarily because all in all, I'm really passionate about the vision and mission of the agency and the people we serve. And the services that we provide, I think, are so very important. And by and large, I think this agency does it best. And so there's a lot of that pride about their passion and aligning of that passion with the organization. And this really does exemplify fit in that the model we talked about with the job embeddedness, that people have made deep commitments to this work and they view them as really fitting and connecting with the organization. And some people even described it really as a sense of calling, that they felt like they were really meant to do this work. Often people had family members or other reasons like that, personal reasons that they came to this work too. The second area was support. And people who stayed such a long time really talked a lot about the relationships they have built in the organization, talking about people as friends or comrades, family, and you go through difficult times together and you form really strong bonds. And this exemplifies links in the job embeddedness model. So this person could name off all the supervisors they had from day one, and he still is friends with all of them and they're valued comrades. And so having those strong relationships really helps people feel connected and want to stay at their organization. And these supportive relationships foster trust and feeling valued. And so this person was talking about a new position that they were asked to take on that they didn't want to do, and they weren't pushed into it. And they were able to make other decisions, and that made them feel valued and that they had a voice. And this comes up over and over again when people feel like the organization cares about them as a person and cares about their thoughts and their opinions and listens to them. That is one of the key predictors that we have seen in other research of predictors of commitment to the organization and eventually staying. And here's another little quote, that people trust you to be competent, and if you're not, you get competent quickly because you're given the sense of trust and autonomy to do things. The third area were opportunities. So people talked about getting something out of the job themselves. They have personal growth and opportunities to contribute in meaningful ways. So a little quote there for that. And often this was connected with a sense of flexibility. So this person was talking about they probably wouldn't have stayed so long if they hadn't been able to move around to other positions. And so this person could learn and grow and have that ability to move laterally, horizontally, and vertically. And so for some people, trying new things and growing is, well, for all of us, growing is important, but some people really want to try new challenges. And if you have that flexibility within your organization to be able to do that, those people really value that, and that they attributed as one of the reasons they stayed. And opportunities, again, highlight that sense of autonomy and feeling valued. So being able to be creative and thinking about that, doing their work in different ways. And so this person said, you know, not going to get your way all the time, but they did have considerable autonomy. And this is another quote, that as they evolved, he or she felt like they had voice in everything that they did, being part of that, and even early in their career, being able to have a voice at the table is important for people. And lastly, their personal attributes. So some people talked about being laid back, not high strung, you know, kind of able to hit the bumps in the road easily. And other people talked about seeing progress and also recognizing that progress can be in small things too, and having that sense of positive outlook on things and being strength-based was important. And then some people said, just don't like change that much, and really valuing this sense of longevity and stability. And this person said, you know, he could have also done like 9 to 5 work at the bank kind of guy, you know, but for him, just valuing that sense of security. And another person mentioned that too, but also talked about how things might be changing, that when they were younger, having the same job for a long time was valued. And now in our culture, maybe not. A lot of younger people, especially, look at wanting to advance their careers by going to different places. And that might be a different way of looking at things. And so we can think about that. So pivotal points. Almost all of us have had times when we have considered leaving our organizations. And some of the earlier research talked about these as shocks to the system. So you might have personal shocks, maybe your health or a family member's health changes. Your family situation may change. Your values may change. You might develop new interests. Your job may change. There may be new tasks that you need to do. You might get a new supervisor, new leadership, mergers. All of these kinds of things are those shocks to the system, and maybe the pivotal points when people think about leaving. And these are the kind of things that people talked about in our sample. And when those shocks happen, we start thinking about, and we might look for other opportunities. They started comparing, weighing the pros and cons of leaving. So we asked then, well, what made you stay during those times? And the same kind of categories came up before, but the key ones were really the relationships and the opportunities. And so under relationships, people really felt this sense of responsibility, not just to the people they're serving, but the people they're working with. And so during those hard times, feeling that connection was really what helped them stay. And being able to talk about those issues and feeling like you were understood and heard. So that other quote there. And one person talked in particular about some difficulties they had with depression and how people were very supportive of them during that time, and made them take good care of themselves. So you can see this sense of people feeling valued and connected as being critical. And then opportunities. So when a person was thinking, I gotta get out of here, this is not good for me. Right at the same time, a new position came up within the organization, and this person was invited to join that team. And talked about the deus ex machina. And for those of you who are not familiar with that term, because I did have to look it up after doing that interview. So in storytelling or movies or novels, when a character feels like they are in an untenable situation and they can't get out of it, and it's solved magically in an unexpected way. But having those opportunities within your organization can help people stay. And this person talked about having had some leadership training and being able to grow through their position and feeling like also relationships, they're respected, but they had those opportunities to grow outside of themselves. So what are some practical implications from this study and the broader research findings? First, with passion, when you are trying to find people and you are recruiting people, looking for that fit with your organization's mission and vision statement. So where is the applicant's passion? Ask them about what brings them to this work. Listen to those stories, and do they really align with what you're doing and what your mission is? And then you can foster passion as well. Sometimes people are right out of school, they're not really sure what they want to do, but they think it's a great connection for them. You can foster this sense of passion by making sure that your organization's values are clear, that you're sharing those values and those passion in your meetings, having retreats, maybe having posters or pictures on the wall, visual representations, but really living those values. You don't want to just have a value on the wall and then do something that is in opposite to that, because that's very demoralizing for people. So really living those values. And success stories can help with passion. A lot of times in our work, we don't see the successes. And so if we can have clients come back and share their stories, or we can share stories of success that we have with our team members, that can help build passion. We can nurture relationships because support is so important. Helping people get to know each other and taking that time. We often feel like we're so busy, we can't take time to do the small talk and the chat. But those relationships are essential to our employees wanting to stay. So can you make time for lunches or coffee with people? Can you have some social gatherings where people can get together? Even during the pandemic, people would have Zoom office hours, or with my team, we would often play games on Zoom and play against another team in the evening. So you can do things like that. We should do training for our supervisors. How do you do person-centered supervision so that people feel valued and connected to their supervisors, and that can help increase their fit in the organization. And also supporting autonomy. Sometimes for supervisors, it's difficult to delegate and let go. And so how do we support autonomy and help people feel valued and trusted? And as always, as I'm going through here, if you have additions or suggestions on all these things, please share them in chat too. Let's see, opportunities. Within your organization, you can review opportunities for promotion. A lot of times we hear in mental health, you're maybe a case manager and then a team leader, and there's not a lot of other steps in between, and maybe someone doesn't want to be a manager or they don't have great management skills. Are there opportunities for advancement within your roles as well as taking on new roles? And is there support for people to be supervisors or to take on new opportunities? And so having that training available and supporting people in this new skills, and having the support for people to be creative and to contribute ideas to solutions. So hearing the voices of staff members. And what people are starting to do now in organizations are to conduct their own stay interviews. A lot of human resources will conduct exit interviews. Why did you leave? And some people, if they're leaving because they're upset, they may not tell you the full story. They may not even want to talk. But you can conduct stay interviews and talk to people about, why are you staying in this organization and what would help you stay? You might even ask, what would make you leave? And that's kind of a scary thing to hear, but if you know what would make them leave and you have some ability to do something about it and follow up with that, it can be very powerful because they feel valued and heard. And so that's good. And then personal traits. So when you're selecting people, how do they fit with the job? And one of our people used this blue jean and sneaker crowd. And I love that because a long time ago, I was once invited to Japan to do some consulting for assertive community treatment teams. And I was expecting more formal attire and, there was more hierarchy in their culture. But when I got there, they looked just like the ACT teams I was visiting in the US, and they were wearing their jeans and their tennis shoes, and they had a guitar in the office, and it just felt like the same people. So you can kind of see, depending on the type of work you're doing. One time, a leader in the ACT, the sort of community treatment field, told me he looks for people who come from large families because they're used to chaos and being able to speak up and get their needs met. So you might have different things like that when you're searching for people. But we also can train people to have the types of traits, to be able to manage stress better, to be more laid back. And so we can teach them about stress management and motivational interviewing and having difficult conversations. And these are some of the topics that I cover in the Breathe workshops that I've done. And there might be others. So before we get to questions, real quickly, I just wanted to point out one of the key limitations is that we talk to mostly white people in leadership positions, and a lot of them were men. We did notice that when we put out the calls for inviting people to participate, that people of color were less likely to say yes. But they were also a little bit less likely to be in the stayer group. And that may show an equity concern. Were they less likely to be hired and promoted? Were they kind of that leaky pipeline where maybe they got into the mental health field, but they weren't being promoted enough and then left? is it also a historical effect? And so we interviewed people who had been there at least 14 years, and some of them had been there up to 30 years. And so the times were different then, and maybe they're hiring and doing better on diversity now, but they weren't 30 years ago. So right now we're working on a second round of interviews and really trying to identify people of color who have been there for longer and to see why they stay and what that might be like. Another thing that we need to think more about is this pandemic has a lot of people rethinking their priorities. And so that passion may shift. There are different opportunities. And our relationships, our links may be enhanced or maybe strained or even broken during this pandemic time. And so that'll be interesting to look at. And there may be different types of stayers. So are you enthusiastically staying at your organization? And those are the people you really want to encourage and nurture. Or do you have reluctant stayers who feel stuck? They don't want to leave because they're going to have to give up their health insurance, or they don't have other opportunities. And then are there things you can do with them? So I want to turn it over to what questions you have now. And I think Emily might help me with that if there are specific questions.
Yep. It looks like we already have a couple in the Q&A feature. The first one is, can you suggest resources for person-centered supervision training?
Oh, Sadaki, my colleague Sadaki Fukui. He actually has a study proposal underway at NIMH. So if you email me, I can get you linked up with Sadaki, but he does have some information about that. Great.
Awesome. If anybody has any other questions as well, please continue to put them into the Q&A feature at the bottom of your screen. But we also had a comment, you touched a little bit on this in one of those last slides, but can you talk a little bit more about how the study mainly focused on the white population? The white population has usually more stable lives than biracial, indigenous, and people of color, and those folks, and talk just a little bit more about that. Carlos had put into the Q&A feature a question about whether those sorts of things were considered in this study, issues such as segregation, racial strife, racism, group violence, hate crimes, and just commented that it is difficult to live in a community and it's not so much a stable permanence thing in a job.
Yeah, and that is something that we want to learn more about. In our interviews, there were 2 people of color that we interviewed, and we didn't have specific questions about race or background like that. But in our new series of interviews that we're looking for people who have been there, I think it's at least 7 years to interview them, who are people of color. And we do have some questions about that. And so that is underway now. One of our colleagues is very interested in structural racism, and he does some work in school settings. And so he really wanted to do these interviews and to work with that data to understand, because those are exactly, a lot of those factors are coming into play. That I'm sure that's part of it. And this organization did have a Black leader for a while, for actually several years. And then when that person retired, I think was replaced by a white person, as far as I know now. But they did have some people in leadership who were people of color, but they didn't respond to our invitations by email as well. And so there may be also a sense of trust and trying to get to know the research team. So we did go and do a site visit. Part of the problem was normally we would go in person at the beginning of a study and get to see people and talk to them about why we're doing this, but because of the pandemic starting and it was early in lockdown, they didn't want us visiting. They didn't want people coming into the organization. So it was different. Another quick resource for everyone, Adam Grant is an organizational psychologist, and he has a podcast that is terrific called Work Life. And that he interviews people, he brings in all kinds of research on these types of issues. And I love his podcast. So, yeah.
Awesome. Thanks so much. Our next question is, what impact did retirement age have on this?
Yeah. So there was one person we couldn't interview because they retired prior to us being able to contact them. So there were some people who were close to retirement, and they talked about that we did ask, like, do you ever see yourself leaving in the future? And most people would say, not until I retire. We did have one person say, if we had another merger, I probably wouldn't stay because that was very stressful for them.
Thank you. Our next one is, I'm curious if or how generation and age play into how people think about staying at a job, and how we might see a shift as Generation Z is coming into the workforce.
Yeah, I think that is a huge thing. I have children in the Gen Z population, and they do think about it as different. And even my daughter, who's more Gen X, I guess, whatever the one is above that, was thinking about moving after she had been at a position for a couple of years. And I was like, well, why would you do that? You have the opportunity to move up in the same organization. But I do think that this idea of the gig workforce and trying small things and moving around is different. And from people maybe in my generation and older, where that stability was really valued. So it'll be interesting to study that. I don't have good answers on that, except maybe making opportunities to grow within your organization, making your organization have strong relationships and culture so people will want to stay. But if they want to go elsewhere, if you love something, you let them go and they may come back. And we did have some people, I think they called them boomerangs, where they talked about people would leave and realize the grass wasn't greener, and then they come back. So I think those are things we could do, but we may see a different trend now. Yeah.
Thanks. I think we have time for one more. And the next one in the list is, a lot of the reasons you identified for people staying at a job were because of personal qualities, work culture, etc. Yet other areas have less turnover than behavioral health. What do you attribute to the difference between fields of work and turnover?
Yeah. Well, I think some of what we saw in our earlier studies, there's early turnover where I think in behavioral health field, it is stressful, and people come in with high expectations of helping people change their lives, and then they get into it and they might be dealing with bed bugs or transportation issues or safety issues. And so that mismatch in expectations. We also see a mismatch in, I'm ready to help people and save the world, and yet I've got all of this paperwork to do and it's not really aligning with my values. And so I think in behavioral health, those are some of the things that do come into play that might not be the same in some that have lower turnover. But those are excellent questions. And I know Emily has to do some final wrap-ups, but I always like to know what's one thing that you want to apply from today's webinar. If you could just share in chat, so when Emily does her formal ending, just share in chat one thing you want to take away and that you're going to do differently. And then here's my contact information. I love hearing from people. I love helping you find resources, answering questions, and the person who wants me to contact you with person-centered supervision, I can do that too. So I really thank you guys for your time. I love giving these talks and not seeing you, but talking to you. Yeah.
Thank you so much, Dr. Salyers. That is all of the time that we have today for the presentation and for question and answers. So everyone, please take a moment to complete the brief SAMHSA required survey by visiting the link presented on the screen. We've also dropped it in the chat, so you can click on it there. Afterwards, you will be automatically redirected to additional questions from the Southeast MHTTC regarding the impact of this event on your knowledge and skills. There you can also download our certificate of attendance for your records. Please just allow about 5 to 10 seconds for your browser to redirect you. So I'd like to just thank Dr. Salyers again for providing all of this information and for answering all of our questions. That's all the time that we have for today. So thank you everyone for your participation. Thank you again, Michelle, and that will be it. That will conclude today's webinar event. Thanks everyone.